Welcome to the premiere edition, weekly edition of News Long Beach, a news talk TV magazine produced by VoiceWaves in partnership with Palacio de Long Beach and the public access digital network PadNet. I'm your host, Andrea Sulsona, publisher and editor of Palacio, the only bilingual magazine in the city. According to the 2010 American Community Survey of the U.S. Census, 22% of Long Beach residents do not have health insurance. This could all change thanks to the Affordable Care Act and Covered California, the state-run health insurance exchange that has been up and running since October 1st. Long Beach residents without health insurance can finally have access to health care, either through health insurance subsidies provided by the federal government or through the expanded Medi-Cal. Here to explain what the Affordable Care Act means for all of us is Cheryl Barrett, Preventative Health Bureau Manager, and Anthony Lee, Program Coordinator for Medi-Cal Outreach Programs, both with the Long Beach Department of Health and Human Services. Welcome.
Thank you.
Now, we've all heard the countless stories about the Affordable Care Act, some true and many not true. So let's start by clearing up one big question. What's the difference between the Affordable Care Act and Obamacare?
So the Affordable Care Act and the Obamacare are the same thing. Oftentimes people refer to the Affordable Care Act as Obamacare, sort of like another nickname, referring to it by another name, but they are really the same entity or the same type of subject matter that we're talking about.
Wonderful. Okay, now let's put to rest the other myths. I have to give up my current employer-based health plan and buy it from the government. Is that true, Anthony?
Not really. If you have health insurance through either Medi-Cal, Medicare, or through your employer, not much changes for you. There's not much changes at all.
Okay, here's another myth. My Medicare benefits are going to be cut.
So there will be no cuts whatsoever with the Medicare program. In fact, the Affordable Care Act adds some provisions to strengthen the Medicare program, such as reducing Medicare fraud.
Okay, wonderful. I'm a small business and I'm going to have to buy health insurance for my 3 employees.
That is another big myth. Small businesses, a small business under Covered California is a business that's under 50 employees. There's no mandate, but there's a incentive for them. So if you have under 25 employees, you are allowed subsidies to purchase health insurances for your employees, but it is not mandated. So small businesses are under the individual mandate, not the business mandate.
Okay, wonderful. So now that we've dispelled these myths, let's deal with this simple question. I don't have health insurance. What do I need to do?
There are many, many ways that interested individuals can get information about health insurance. As everybody knows, we have a website in the state called Covered California, coveredca.com. That is where people can get information and also download information by paper, get some help online, and also call help through their 1-888 number. And the Long Beach Health Department is also available to assist individuals. When you go to the website, coveredca.com, people will be able to search a certified enrollment entity or a certified enrollment counselor that is available within their area where they live so that they can get more information, or if they are ready to enroll, actually get help into being signed up into one of the health plans that's available to them.
Okay. What if I can't afford the cost of insurance in the Covered California marketplaces? Then what are my options?
Well, basically, the Affordable Care Act looks to insure people in 2 different ways. One is by expanding Medi-Cal to adults 19 through 64, and another through the subsidies of Covered California. How much subsidies you get depends on how much income you are. So if you are low income, you will get some help to help pay your monthly premiums. And this monthly premium can come on a monthly basis or at the end of the year when you file your taxes.
Wonderful. So explain Medi-Cal expansion and who does that help?
So Medi-Cal expansion allows people up to 138% of a poverty level to now be eligible to apply for that. Basically what that means is approximately $32,500 household income for a family of 4. Yeah. Under the Medi-Cal expansion, childless adults can also now qualify between the age of 1964, like Anthony explained. So this allows for more people that did not qualify before for Medi-Cal to now be able to sign up and get health insurance coverage.
Excellent. Anthony, let's talk about the young people, the so-called invincibles, the ones that don't think that they need to get health care or health insurance, I'm sorry. What do you say to them?
Well, you know, let's say you're 27 and you're young, you're active, you participate in a lot of physical activities, you do marathons and all that, so you're pretty healthy, you eat well. So a lot of times these folks think that they're invincible. I had one individual that actually came into our office and he wanted to apply for Medi-Cal thinking that he was eligible for Medi-Cal based on the new rules. And because he had hospital bills from a mountain bike accident, you know, he went into the hospital. He wasn't even hospitalized. He was in there for about 12 hours. And he came out with the bill of almost $18,000 for that, for stitches that he had to get.
Otherwise, he was totally healthy.
Otherwise, he was totally healthy. But, you know, you can't account for accidents that are going to happen, or accidents for a reason.
Right.
We have car insurance for accidents. You're susceptible of getting sick. You need to have health insurance.
Okay. What are the deadlines for signing up, and what are the penalties if you do not sign up?
Open enrollment period for Covered California started October 1st and it will end on March 31st, 2014. However, we want to remind people that if they want their healthcare coverage to begin on January 1st, 2014, they have to complete their application by December 15th. For folks who qualify for the Medi-Cal program, there is no open enrollment period. We would be able to accept applications to process that throughout the year.
There's been stories of people having problems enrolling online, but what about those people who don't have access to the internet or don't speak English, or even those people that might need a little extra assistance? How can they get help?
Well, currently we're outreaching to different health fairs, community events, and trying to educate the general population on how to apply and educating them on their different choices so they can make an informed decision. We're partnering up with different CBOs within Long Beach to help spread the word. And
what are CBOs?
Community-based organizations. We're in partnership with many of them throughout the city of Long Beach, and they help spread the word of the Affordable Care Act. And then they can also refer to us for more information if they want to sit on one-on-one as well.
So you actually have people that can work hand in hand and sit with people and help them to, is it a long application?
The average application time, they're looking at 90 minutes, that's what they're saying, because it is a lengthy application. It's about 40 pages total if you look at the paper application. But more of it is education, because a lot of times families have so much choices now as far as what metal tier to buy and what health plan to buy.
Talk about the metal tiers. What do you mean by that?
The metal tiers, so under Covered California, if you have heard some of the lingo used, is that there's that apples to apples comparison. So now with the metal tiers, you know exactly what you're getting. So if you start with the first one, which is bronze, you're looking at a 60-40 ratio, 60 being covered by the health insurance, 40 being covered by the consumer. And then silver is the next one up, and then it's 70-30. And then gold would be 80-20, and then platinum 90-10. So how much you want to pay is based on how much, you know, which plan you're going to pick. And then there's also the different health plans that are available as well. So all that dictates how much you're going to pay out of pocket.
So these are the health insurance companies that many of us are familiar with. The government will subsidize.
Yes.
Okay. Okay. So if I already have health insurance, you said something about Healthy Way LA. I remember you talking about that, and how that will convert to Medi-Cal. Can you talk about that a little bit?
Well, currently what we're telling families that the best way to assure that they qualify for Medi-Cal is to go through Healthy Way LA right now. Because come January, that Healthy Way LA will convert into Medi-Cal. So then there's no, it's seamless process. So these individuals and families would be just transformed into Medi-Cal, so they don't have to go apply online.
Effective January
Yeah.
1st. Okay. So what part of the population has to really be concerned with taking care of this? Like what percentage? If you already have Medi-Cal, you're fine. You don't have to worry, right?
Correct.
So-
We still have a lot of work to do. One of the key things about Affordable Care Act, it makes affordable health care a reality for many people. In Long Beach, based on the statistics that you mentioned earlier, that's about a little over 100,000 folks that are in our community without health insurance at all income levels. They might even be making over some of the thresholds or even six-figure incomes, but the new Affordable Care Act will give them some subsidies and also allow for them to purchase a plan at a lower cost. So we're looking at it across the board level, folks from all different incomes to be able to apply into this new opportunity.
That's fantastic. How does California measure up? I've been hearing a lot about the Rhode Island, the state versus the federal, and the federal having some problems with the enrollment. Can you talk a little bit about that?
Cheryl, you want to talk about
Sure,
that?
absolutely. So California, as you know, is one of the 17 states that have elected to have its own insurance exchange through Covered California. As of the most recent statistics that we received from Covered California, we've had over 2.2 million unique visits to the website, and the calls are now being handled within a 15-minute time frame. So we're getting better in terms of handling the traffic on our website and not seeing as much of the difficulty that we're hearing in the news about the federal healthcare.gov website.
So the states are doing much better than the federal
Absolutely,
level.
yes.
Okay, and that probably has a lot to do with the shutdown, right? Did that slow things down on the federal level a little bit?
I don't think we can answer that because that's not part of our.
We don't exactly know, but potentially because a lot of the workers were furloughed, that could have probably impacted the ability of the system to accommodate the traffic online.
Okay. Well, thank you very much for helping to clear up some of the myths and misinformation about the Affordable Care Act. Now here's where you can find more information.